And the third slide explains the difference between narcotics and non-narcotics. Okay? About non-opioid analgesics, we have many types, but the most important type and the most famous is acetaminophen and non-steroidal anti-inflammatory drugs. The next slide is showing about and is telling about the inflammatory reaction and how this reaction is initiated. And here the next one include the mediators of acute inflammation, and the next is talking about the mediators of chronic inflammation. This is pathophysiology. The most important slide here talking about the lines of therapy. But we are not concerning about the disease modifying antirheumatics. We are concerning in urology about non-steroidal and the opioid and the difference between them. Here the non-steroidal anti-inflammatory drugs in general, they block prostaglandin synthesis, either irreversible aspirin or reversible the traditional non-steroidal anti-inflammatory drugs. And from their name, they are analgesic, affect low to moderate intensity of pain, antibiotic, anti-inflammatory. Okay, then the new era today is related to COX-2 selective inhibitors. We have two types of COX inhibitor, either non-selective and selective. And this slide is talking about the selective COX-2 inhibitors. In spite of they are having anti-inflammatory, analgesic, antibiotic actions, they are similar to the non-selective inhibitor as in analgesic and anti-inflammatory antibiotic action. But they have less gastrointestinal effect, but the same renal toxicity. Okay, then every effect has its mechanism of action. But for your career, there is an important question related to: can surgical procedure done after stopping aspirin for less than 7 days? Yes, because when aspirin is given, then stop it, platelet generation build up daily and gradually replace the inhibited platelet. What percent of platelet will be replaced before 7th day, say by the around 5th day. In spite of the platelets won't be completely replenished, but there will be enough number of platelets to maintain good hemostatic response, particular if we put in consideration the wide range of normal platelet count. However, it's more safe to postpone surgery till complete replenishment of platelet after 7 to 10 days. Okay? This may become in the form of question. These two slides talking about aspirin before surgical operations. We must put in mind that there are contraindications of non-steroidal anti-aspirin. They are contraindicated to be taken and must be avoided in patients with hepatic disease, hyperthrombinemia, vitamin K deficiency, or hemophilia. What about the uses of non-steroidal anti-inflammatory drugs and aspirin? They treat mild pain, treat fever, treat musculoskeletal disorder as anti-rheumatic effect, treat rheumatic fever, especially aspirin, reduce thromboembolic events in coronary and cerebral circulation, and particular aspirin could be taken to remove warts as it represents a keratolytic effect. So this slide, as we have been talking on the uses of salicylate, aspirin, and the non-steroidal anti-inflammatory drugs. Okay, then here the interaction of non-steroidal, and we must know, of course, by name the non-steroidal anti-inflammatory drugs, and why COX-2 selective inhibitor produce cardiovascular complications. And so, for example, rofecoxib is withdrawn because of higher incidence of cardiovascular thrombosis. Okay? And don't forget to compare non-steroidal aspirin with acetaminophen. Acetaminophen is analgesic antibiotic with no anti-inflammatory. There is no effect of acetaminophen on gastrointestinal tract, cardiovascular system, or platelet function on the opposite side of non-steroidal. But the main side effect of acetaminophen is hepatotoxicity. And thank you.